Hey everyone, welcome to Exploring Health, Macro to Micro. I'm your host, Parker Condit. In this show, I interview experts from all areas of health. This can be from areas that you would expect, like exercise, nutrition, and mental health, while other topics may be from areas where you are less familiar. Today's conversation is all about personality and what influences our personality. And here to discuss that with me is Dr. Shannon Sauer-Zavala. Dr. Shannon is a clinical psychologist and academic researcher who's dedicated her career to developing psychological treatments to help people recover from mental health difficulties. She's also authored 3 books. In this episode, we go over the common online personality tests and talk about the Big 5 personality traits, which actually has the most reliable research and validity when it comes to personality. Dr. Shannon dispels the myth that personality is permanent and goes over how to nudge your thoughts, beliefs, and actions if you want to shift your personality. So I think this will be a great episode for anyone who wants to learn more about themselves and better understand how to make changes in their life specifically to their personality. So without further ado, please enjoy my conversation with Dr. Shannon Sauer-Zavala. Shannon, thanks so much for being here. Let's start off with the basics. A lot of this is going to be kind of based around personality and some of your work there. So I think it'd be great to get a baseline of understanding what exactly personality is. So we're starting with a common definition, and then we'll kind of break down some of these more interesting aspects that you spend a lot of your time researching and studying.
Yeah, great. Love it. So I think it can be helpful to talk about what personality is not first. And so a lot of people think of personality as your essence, your sense of humor, your likes and your dislikes. From an academic perspective, that's not really how we're defining personality. And so personality is your characteristic way of thinking, feeling, and behaving.
Okay, that's a good place to start. And I've kind of learned that structure through kind of going through therapy on my own of like, this is how you need to kind of think about the tiers of things.
Yeah.
Is there like a hierarchy? I've seen this written out visually, or is it if you're trying to address personality, you should start with thinking, or should you start with how you feel? Should you start with behaviors? Is it different for everyone?
Yeah, that's a great question. It is different for everyone. So one of the things that we know about cognitive behavioral therapy, right? So when we're thinking about targeting your thoughts and your behaviors, right? CBT is right in that wheelhouse. One thing we know is that as a treatment package, people tend to experience relief from symptoms of anxiety, depression, other issues that you might go to therapy for after the entire package. But we don't really know who would benefit from what skills, right? So like, are you a person that would benefit from cognitive skills? And maybe I'm a person that would benefit from behavioral skills, or vice versa. So it really is different for everybody.
Okay, that's helpful. So then understanding personality, a lot of people, and it's easy. I think there's a lot of messaging around the somewhat static or definitive nature of it.
Yeah.
And it's kind of fun, right? Because I think humans can be like, it's a lot to process in the world. So we kind of use buckets and categories to simplify things. Be like, I am this, whether it's a Myers-Briggs or an Enneagram or a horoscope, whatever it might be. Can you discuss the maybe lack of definitive nature around that, and like how dynamic can personality really be?
Yeah, that is a great question. So I think there's a couple things to unpack there. First is you named a bunch of different personality questionnaires. These are the ones that if you type into Google personality test, you're going to see Myers-Briggs, you're going to see Enneagram, you might see DISC, right? And if you work for any kind of corporation, you've probably had your HR department kind of do team building and have you take a Myers-Briggs or a DISC assessment. And one of the things that I think is so interesting as a personality scientist is that the measures that we use in kind of academic settings and in personality research are so different than those that are used by like corporate America, by guidance counselors to funnel people into their ideal roles. And so the research that does exist on the well-known, really easy to get your hands on personality questionnaires is super limited. There's not a ton. And the data that do exist kind of show that these tests don't predict career success, which is a real bummer because that's what they're being used for. So I think it's worth kind of talking about the limited research support for these measures, right? And I think, you mentioned horoscopes too. And so I see a lot of college student patients, a lot of kind of like Gen Z generation. And, people will be like, I'm an ENFJ, right? So that means X, Y, and Z about me. And so people do have this notion that this is who I am and it's static. It's not going to change. So I can't do X activity because I'm not Y characteristic enough. And so part of the reason that I started to come on podcasts is because that's just like a myth that I think it's really self-limiting. And so what we find is that across the population, personality changes on average as people age. So people tend to experience fewer negative emotions. So they tend to be less neurotic. People tend to get more extroverted, more conscientious, more open to new experiences, and just more oriented towards other people. And so that's good news. There's a lot of variability there. So some people change a ton and some people kind of hold steady. And what we see now as we're starting to target personality in treatment or like with interventions is that you can speed up the process. So you can see like 20 years of personality change in as few as 20 weeks by taking intentional actions to nudge your personality.
Interesting. There's a lot I want to dive into. I want to start with this. You started mentioning some personality traits. So the differences between like what you're going to see from a Myers-Briggs, for example, ENFP, INTJ, whatever it might be. And then you started mentioning what I think are the big 5 personality traits. Are those the pillars that you sort of use in the research setting?
Yeah. So the big 5 has probably the most research support. And so I kind of feel like, the big 5 needs like a PR person because, in the Myers-Briggs, like when I take the Myers-Briggs, I find out that I'm a protagonist and I'm like, ooh, yes, that suits me.
They've got fun. Yeah. They've got fun names too. I forgot about that.
Yeah. Right. And so I can see why people would gravitate towards that. Once you start taking kind of the different sort of levels on different traits and trying to put them into even bigger like super categories like protagonist, that's when we start to lose validity. And so the big 5 is really interesting. So when psychologists, researchers were sort of trying to understand differences across people, they actually just opened up a dictionary and pulled out any words that described human nature. And then they tried to group them into similar categories with similar themes, right? So like kind and thoughtful and caring would have been grouped together. And basically they found that as you reduce and you reduce and you reduce, that you couldn't get fewer than 5 categories, that all of the words that describe human nature can be kind of summarized by the big 5. Really creative with our naming in psychology.
But effective. Okay. Can you run through what those 5 are?
Yeah, absolutely. So neuroticism is the tendency to experience negative emotions. People differ, right? Some people tend to get more upset, tend to be more reactive to stimuli in their environment, tend to take longer to calm down. And so, in my practice, I see a lot of people with anxiety, depression, borderline personality disorder, higher on the neurotic side of things. Then you've got conscientiousness. That one is another one that really predicts career success. People that are higher in conscientiousness tend to make more money, tend to be more achievement striving. And that's on a continuum with disinhibition. So that's being more spontaneous, impulsive, maybe not so great at planning. Then you have agreeableness, right? And so that's like how well you get along with other people, how much you trust others, how friendly you are. And that's on a continuum with antagonism. And that's one that I think is so interesting because there are problems at both sides of the continuum, right? If you're too agreeable, you're a people pleaser, kind of a doormat. And if you're too antagonistic, then you have problems.
Yeah, right? You're just a thorn in the side of people.
Yeah, right. And I mean, conscientiousness is like that too. If you're too high in conscientiousness, then you're perfectionistic, maybe a little rigid. So I think it's interesting. There's no right level. It really just depends on what you want to do with your life. So, okay, we said neuroticism, agreeableness, conscientiousness, extroversion. So another one that this comes up a lot, I think, in like pop psychology, introversion versus extroversion. And so a lot of people think that extroversion is like how social you are or how much you enjoy being around other people. And that's certainly part of it. But really, it's more about having like energy and a lot of activity and a lot of excitement and positivity. And so being kind of a social butterfly, life of the party type of person, it kind of gets folded in with that. But it's also how quick to positive emotions and excitement you are. And then the last one is openness. And that's just how interested are you in new experiences and ideas? How willing are you to kind of engage with like fantasy or imagination versus like how traditional or conservative or, you like things how you like them you are.
All right. So, I mean, you finished with openness. Are people who are higher in openness, are they going to have an easier time sort of changing their personality?
Yeah, I mean, I think so, right? Like, I think, when you get too high in openness, and this is true of all of the domains, right? Too high in openness, it can kind of be a liability. You spend so much time like kind of fantasizing about things, or there's just so many things that are interesting to you that it's hard to then and like take the leap into anything. But yeah, I think there needs to be a certain level of willingness to believe that just because it's always been a particular way doesn't mean it has to stay that way.
Yeah, very much. Yeah, so a lot of this is just a practice and balance, and I guess understanding kind of where you are along the spectrum of these various. Do we have parts of all 5 of these in us, just at varying degrees? Okay, that's helpful.
Yeah, and so when you think about people, right, like most of us or many people are kind of moderate on some of them, and then you're sort of usually like kind of at an extreme on like one of them. And that's the thing that you would be like, oh, like Shannon, she's extroverted. Right. And probably wouldn't comment on the other.
Right. Okay.
The other ones.
Gotcha.
But they're there. Everyone has a level on each domain.
Okay. And then you mentioned nudging personality. So I'm guessing that's just, you don't want to take somebody and be like, you're just going to be a new person tomorrow. So Can you describe the process of nudging and sort of what sort of subtle changes you're looking for? Like if this is something that you're working on with somebody, how do you sort of help them sort of stepwise kind of make this progress?
Yeah. So it's worth kind of going back to that definition of neuroticism, right? Your characteristic way of thinking, feeling, and behaving. And so, if you maybe are not a particularly conscientious person, but you start to tell yourself, if I show up on time to things, that shows other people that I respect them, right? So you're kind of changing your thinking. And if you feel pride when you show up at like brunch before your friends get there, and if you engage in behaviors that increase your timeliness, like setting an alarm or an appointment reminder, then you're starting to embody the characteristics of a reliable or conscientious person. And if you maintain those changes over time, then in essence, you become more conscientious. You've shifted your personality a little bit. When you take a personality test, you're gonna maybe instead of, do you tend to plan ahead and you say strongly disagree, maybe you say disagree or neutral, right? And so you can see how that can change over time. And so usually when I'm kind of thinking about personality change with somebody, I first want to know, what's your buy-in? Like, why? Because making changes in any capacity is really hard. And so like, I like introversion versus extroversion for this because, if you are introverted and you have a job where you don't have to interact with a ton of people and you get a lot of fulfillment over like through fewer, closer relationships and like it's working for you, then there's no reason to nudge your personality to be more extroverted, right? However, if you're a person that, is also really high in conscientiousness and you have high achievement striving and you want to move up in your job, but the next level would require public speaking, right? And would require managing people, then maybe there's an incentive to try and nudge yourself to be a little bit more extroverted. So that's one of the things that I'm first going to be looking at when I'm talking to somebody about potential personality change is like, why do it? Because again, like I don't think any level of the traits is inherently better than another.
Right.
It's really just, does it match up with your goals and values? So that's kind of the first piece. And then we start to identify, do you have any patterns of thinking that are keeping you stuck in a particular way of behaving, right? So, if you tell yourself, you're constantly telling yourself like other people can't be trusted or other people are only out to get themselves, right? Or
Hmm.
only out for themselves. That's
Yep.
probably going to keep you behaving defensively, maybe more apt to put a wall up, right? And that's going to be, kind of keep you lower in agreeableness, right? Or maybe you're the type of person that tells yourself, I need the adrenaline of the last minute to start packing for this upcoming move. I couldn't possibly start ahead of time. Again, that's going to keep you stuck. With neuroticism, it looks like I hate the way these feelings feel. It's weak to feel this way. I should avoid these feelings. And neuroticism is kind of an interesting one because the more you tell yourself you don't want to have feelings, the more you have them. So that one's kind of counterintuitive, how you would address neuroticism. So thinking, right? That's kind of where I might start.
So you're saying, starting with the why, that definitely makes sense
Mm-hmm.
because you were also mentioning like any sort of change is really hard, because we just love homeostasis. It's just a great evolutionary kind of trait that we have. So yeah, it definitely makes sense to start with a why because there probably needs to be a strong enough why to get the change to stick over time because you're just going to want to keep reverting back to whatever you've been doing.
Yeah, it's great.
Um, on the idea of neuroticism, or maybe I guess the easier way to do this is through thinking, feeling, and behaving. I know there's like various points you can kind of latch on to. Um, so you as a therapist, because a lot of this is going to be like subconscious, right? It's going to be hard for people to recognize either the thoughts, feelings, or behaviors that are probably detrimental to them.
Mm-hmm.
So like, what do you try to do through CBT or any other modalities that you work with where you can try to unpack the unconscious or subconscious? And I'm never really
Yeah.
sure of the difference between those two.
Yeah. So in CBT, we don't really think about it as being like unconscious or subconscious. Like it's there. You just maybe aren't really like as aware of it as you could be. So, I mean, most of us are thinking all the time. It's just how much are we paying attention to what we're telling ourselves or how much are we taking what we're telling ourselves as like the truth versus a thought, right? Because when you tell yourself, I need the adrenaline of the last minute to get started on this task, like that's a thought. It's not necessarily a fact. Like you don't literally need adrenaline to open a book to study. Like that's not true. That's not true. But people take those thoughts as truth and they don't really question them. And so one of the things that we're doing in CBT or in the cognitive piece is trying to get people to slow down a little bit. So usually CBT starts with self-monitoring. I use this like form with three bubbles on it called three component model: your thoughts, your feelings, and usually it's like physical feelings. So because some people the emotion is really like visceral, physical, and then your behaviors or your urges. And so we start getting people to kind of track that over the week, like do at least one of these forms a day, and just with repetition you start to get better at identifying, oh yeah, I just told myself this thing that is leading me to behave in a particular way. That's leading me to react to other people in a particular way. And so we start to just bring more awareness to what's there. We're just not maybe paying as much attention to it.
Gotcha. Yeah. So that makes sense having like those three bubbles. Cause I was
Mhm.
thinking, like this is something that was tricky for me in the past where it was like, I didn't know, like I didn't have the thought, or I couldn't identify the thought,
Yeah.
but I would just see the behavior. I'm like, why am I feeling so much resistance? And like
Mhm.
procrastination is just so much easier without
Yeah.
necessarily having a thought to tie to it. So that seems like it ties into the urges category where you're like, just
Yeah.
define this, acknowledge it. And then, yeah. So, can you describe, like, from a mechanistic standpoint, why it's so beneficial to write things down? Because I've had so many breakthroughs where I'm like, I've been thinking this for years. How is it going to make a difference if I write it down or say it out loud?
Yeah, yeah. So one of my former colleagues at Boston University had this really cool metaphor, like for like I guess the power of thoughts. And thoughts can be, in the dark of or thoughts are like Dracula. So in like the dark of your mind where they're just kind of swimming around, they're really powerful. They can be scary. They can keep us stuck. But when you expose them to the light of day, they just turn into a pile of dust, right? It's like, oh, when I say that out loud, I can kind of see the flaws in that logic, when I sort of subject it to the light of day. So I think like that can really help. I also think that like it can get complicated, right? Because the way that we think is kind of daisy chaining our thoughts together. Like, I think this, and then that makes me think this, and then I have a memory of this, and then, and so it can kind of go on and on like that. And when you kind of map it out or write it down, take it, make it external to you, it's a lot easier to see the process. It's a lot easier to say, okay, this is separate from me now. These are thoughts that I've written down on this paper, not something that's like true of me. And again, then we have that distance, we can challenge those thoughts a little bit.
Yeah, I think that's what's been most beneficial because like you just externalize it, you get it out, and then the thoughts, it's easier to see to be like the thoughts are not me, the thoughts are just something that's occurring kind of through me. And then I just have thoughts all day. Some of them are great, some of them aren't. Other people have thoughts. It's like you don't need to put that much judgment on them. They are just there.
Yeah, and thoughts are like just like anything else, like biting your nails, like thoughts are habits, right? So if you've thought a thought a lot, maybe your parents, said something to you over and over again, you kind of internalize that as like the truth of the world, just as one example, and you think that thought a lot. When you're in a situation that, that kind of pulls for that line of thinking, you're going to have that thought because that's the thought you have in situations like that, not because that thought is like the correct interpretation of today.
So, I mean, I'm not a parent, but I just immediately went to that. I was like, you could probably use that to your advantage, right? Like that's why you say, oh, you're so smart, you're a good learner, things like that. Cause I think kids that are kind of conditioned with that, they're more receptive probably to whatever form of education they're going to be in. And I think those stories are really important, but at what point do you try to objectively and like analyze that? Probably not in elementary school. You're probably just kind of living through like that lived experience. But at some point, is it worth like revisiting those things and be like, is this actually a truth? Because I mean, you could probably just keep yourself somewhat delusional to your advantage in this society where if you're really convinced that you're really smart and you can kind of do anything, you probably can. Like a lot of people are just kind of like delusional in their own self-confidence, even when they may not have the actual requisite like skill set to kind of back that up.
Well, right. And I think this like speaks to, I don't know, like self-fulfilling prophecy or even really personality change, right? You are who you act like you are, I guess. Right. So, yeah, I mean, and I think like what you just said really resonates with me because I don't know. I mean, I have successfully gotten a PhD and like have an academic job. I'm a professor and a therapist. And like, I am by far not the smartest person in the room most of the time. But when I was little, my mom was like, you're special, you're going places. And I always thought that I was, right. And I'm a hard worker. So I just could like see it as a possibility that I could do whatever I wanted. And so this is why I don't like career tests or personality tests that you take when you're a senior in high school that are like, you'd be a great middle manager. You should do that because you're middle of the road extroverted and middle of the road conscientious. And it's like, how limiting is that? Maybe I don't want to be a middle manager. And so I think to go back to the original question, which was when should we start to analyze our thoughts? And I would say when you are noticing interference, when you are having trouble moving towards a goal, or when you're noticing a lot of distress that's getting in the way of living in accordance with the life that you want to have, right? Because that's usually when we would recommend like, oh, like maybe you should talk to somebody, like maybe therapy would be a good fit for you. Lots of people have anxiety, but it doesn't prevent them from moving forward in their life. And they're not that distressed by it. It's just there. Like I would consider myself a neurotic person. Like I feel my emotions really strongly. I think it makes me a great therapist because I'm pretty empathetic. And when I experience my emotions, I'm like, okay, there it is. It's not really causing me a lot of distress and just stop me from doing anything. But like if your thought process or your emotions or the behaviors that you're engaging in and you're not sure why are getting in the way of living the life that you want, that's probably when you want to slow it down and figure out, okay, like what am I telling myself? How's that affecting me?
That makes sense. So it has to be hard. like, so we just explored an example of like the positive side of that, where, you know, you had support, I had support from parents and then teachers, and you just kind of get that positive feedback loop. So how hard is it if very early on you don't have supportive or encouraging parents, or you have a teacher who says something to you in first grade and you're like, well, this is my experience with education. And you just kind of hold on to
Mhm.
that.
Yeah.
Like how detrimental can that be sort of like years down the line of people? Like I'm 35 and I'll still kind of talk to people around my age and they're like, I'm not good at math. And I think they say that because, and it's like, how much math do you have to do every day? They're like, none. I'm like, why do you, right? It's probably something they were told in elementary school because they didn't do great on an arithmetic test and they're
Yeah.
holding on to it this many years later. So like how hard is it to sort of unwind a lot of that when you get these really early, maybe negative influences?
Yeah. So hard, but not impossible. And so, I've worked with people that have had experiences like that, right? Where they're sort of holding on to this like one formative experience. I mean, I think about that. Like, I had a fourth grade teacher be like, "You want to be a teacher?" to me. And I remember being upset about it at the time, but I obviously didn't affect me that much. Um, so things like that, like one formative experience, all the way to having sort of chronic physical, emotional, and sexual abuse, like kind of growing up at the home from a parent, right? In terms of like, in terms of clients that I see. And most people can make changes if they want to, right? It's like sort of being motivated. And I think making changes in how you respond to the world, how you think about the world, how you behave in the world, how you feel about things that are happening to you, it's really hard. And usually, especially if you're coming from kind of a deficit based on your early experiences, it can be hard to wrap your head around the notion that when I put myself out there, when I'm vulnerable, when I, step outside of my comfort zone, it's going to feel worse before it feels better. And I think that that's where I think people often will stop. But when we can get people that are willing to kind of push through that, push through the sandbar or the barrier or whatever, that's where we can see really meaningful change.
Are there any tools that you have for people? Or is it just kind of mentally preparing them, be like, it's not going to feel great immediately, like, and just kind of setting that expectation, just because, right? Like it's hard when you hit resistance. And again, I kind of already mentioned, like just going back to whatever the default is. Do you have tools that you kind of give people?
Yeah, so usually at the beginning, I try to do like a lot of like truth in advertising and therapy. So like, when people are coming in with difficulties, I am usually right off the bat being like, this is going to be hard. It's going to be great. I have the treatment. I know it works for some of the difficulties that you're experiencing, but this is going to be hard. I'm not trying to just like oversell it at the beginning. Be like, okay, this is going to be amazing. It's going to be so great. You're going to feel so much better, right? And I think some of that is just giving people, I don't know, giving people enough respect to know that if you explain very clearly what is going to happen in therapy, what you're going to ask them to do, that they can, like, you don't have to surprise them with it, right? You can tell them and they can think through, okay, like what are the long and short term consequences of this? Is it worth it to me to do this right now? And sometimes people are like, well, I'm going through a divorce or I'm about to move states. So maybe I don't want to start talking to you about my childhood trauma because I don't want to open that can of worms right now. Like, and that's like a perfectly respectful decision to make. And then some people are like, now is the time. Let's do it.
So I think, I kind of want to start exploring the more like wider area of like mental health care.
Sure.
Where do you think things are going? And I'm also curious to understand, another thought I had around this was, I wonder if it's harder now because we've sort of been conditioned over the past, like maybe 10, I don't know how many years, but we've been conditioned to like for more short-term reward, and
Mhm.
like delayed gratification is harder with just
Yeah.
the entire society that we live in. So I'm
Mhm.
curious if like that is more challenging in your position now. And also like where you think mental health is going, or mental health care.
That's a great question. So this is something I think about a lot because I think the state of mental health care is not great. so if any of your listeners have tried to find a therapist or to find a therapist that's really well trained in like whatever they want to work on, they probably have experienced barriers. Whenever I have to find, I'll have like a friend from, that's living in like DC or like a place that I don't live. It's like, Shannon, can you help me find a provider? And like, with every possible advantage, like they can pay out of pocket, like they're asking their friend that knows people in the field, right? It can still be really hard to find somebody with an opening. And so I think what our field has to grapple with is how to meet the like ever rising demand. And so sometimes people will ask me, do you think that people have worse mental health than before? And I actually don't think that's what it is. Like, I think we're seeing an intense or a higher demand for therapy because people are much more comfortable talking about seeking therapy. It's much more normalized. Like, I think people are much more comfortable asking for help or talking about the fact that they are in therapy. And so we're seeing a shift in the amount of people that are asking for care. And so there are a couple things that I think I don't know, our government should do, I guess. So one thing is to invest in prevention, right? Because all the stuff that I treat in therapy are waiting until there's a problem and then teaching people like literally skills, right? Interpersonal skills for what to do when you experience a strong emotion, how to not procrastinate, right? These seem like really basic things that could be taught in schools. And there's so much variability in what happens in different schools. So like my kids, they go to public school, and they're in a district with like a lot of different public schools. And in my kids' school, they have this UL room where they can go and meditate. They can go take a break if they need to. They go there. I know, it's amazing. But other schools in the district don't have that. And there's really no rhyme or reason really, to why certain kids have access to that. So I would like to see that in a more widespread way. There's evidence that primary prevention can work. I'd also like to see more sort of personalized allocation of care. So we know that like digital interventions can work. So people that do an online intervention where it's all kind of in a computer program or an app, can get a lot of benefit. The problem is that that's not the appropriate level of care for some people that have more serious symptoms. And it's not like super engaging as like talking to a person. So a lot of people drop out. And so I'd like to see more sort of nuanced allocation of like, I think this would be a great fit for these people. They should do that. And that would free up space on clinicians' caseloads to help people that really do need a higher level of care.
That makes sense. Yeah, just getting the appropriate level of care at the right time. Are there, like, what does the pipeline look like for therapists and mental health professionals at this point? Like, is it a growing field? Like, I kind of look at the medical field and it's like nurses are dropping out, doctors are dropping out. Is it similar for therapists and mental health professionals?
Yeah, I don't know the answer to that question. I mean, one thing that is really hard, I think, is that insurance companies don't reimburse us very well. So, you'd have to have a really big caseload if you're taking insurance to be able to like live a comfortable life. And so a lot of people that are good don't take insurance. And so they can charge kind of whatever because there's such a high demand. And that really disadvantages people that don't have an extra $400 a week to spend on a session.
Sure. Yeah, there's a huge financial barrier, which is one of those impossible problems to try to solve. Yeah. I don't know if you want to get into this, but do you think, like, I have so many issues with the health insurance and the healthcare industry in general. I think the profit motive is doing exactly what it should be doing at this point. It's consolidating things, it's driving efficiencies, but none of that is driving better patient care. I hate seeing insurance involved in health in any aspect. And yeah, so then insurance is supposed to make it more accessible for people. But then, like you were saying, the best providers don't take insurance because they don't reimburse well enough. Right. It's just like this. It's like you feel like you're living in a crazy world.
Yeah, it's really stupid. And I, in part of my job, I have had the opportunity to consult in other countries, right? So I am working on like sort of a group treatment, an online companion app through like the National Health Service in the UK. And it's just amazing how they train bachelor's level people under PhD level folks to, so that they have enough providers to be able to give good care. And then also thinking about like group provision of services so that more people can get benefit. Work with the Canadian government this is actually wild, to develop a prevention program for the Mounties. So all of the cadets in training for the Canadian Mounties go through a treatment to sort of reduce their neuroticism, essentially, so that they're less likely to get PTSD out in the field after they are deployed. So people are thinking proactively about some of this.
Yes. But you mentioned it earlier where we wait until things are on fire and then we start to put it out. Okay. It's a very American way.
Yep.
Very frustratingly. Yep, exactly. Do you have any thoughts on like some of the more, I don't know what the correct term is, but like psychedelic assisted therapies? I saw that MDMA treatment was just rejected from the FDA, but there's ketamine therapy. Mm-hmm. Do you have any experience with those or just any opinions on them?
So I don't have any experience like providing. I've had patients that have gotten ketamine, people with really treatment resistant depression, and like have sworn by it, life-changing. I mean, I think as like an academic psychologist, I want to see more research. Like, I don't want to see the door closed, because maybe if the studies weren't giving like the right dose of MDMA, right? Or maybe not quite the right, we just haven't figured it out yet, but that doesn't mean we should close the door on it.
Yep. Set and setting, all that. Yeah. I coordinate with a few ketamine clinics out here. And yeah, it's just pretty remarkable results. I think there's just something wild about being able to like almost remove yourself, like it's a dissociative anesthetic. So you just really remove yourself from your body and the kind of egoic personality almost that you end up being so attached to. And people can, even just getting a glimpse of that can really open up the possibilities for people that are very stuck, as you were mentioning.
Yeah. I mean, and it's crazy, like, because what kind of treatment can you do like one time and get, I mean, I know people will come back, but it's like the dose and the frequency is so different, right? Than like weekly therapy, or like you have to take your SSRI every day for the rest of your life, versus like how quickly people can see results.
Yeah, it's all very interesting. And then I guess the other question I had around sort of like the structure of therapy, which is something I've been thinking more about. Yeah. Is there any research behind like the 50-minute or like 1 hour session, or is that just more of like an insurance based, this is sort of a block we're going to allocate? Or do you think like 3-hour sessions would be more beneficial? Do you think different time modalities?
Yeah. So there's research out of, I'm going to kick myself because I can't remember which European country it is, but research looking at like dose and frequency. And basically like the studies show that if you do, say there's like a treatment, right, that's 12 sessions, and usually it's delivered once a week, right? So 12 weeks. But if you do it twice a week, you can get people just as much better in 6 weeks. So like, I think there is something to be said by exploring. And so that's something like usually insurance companies won't pay for 2 sessions a week. So that's something that I think is limiting. Yeah. And so, so I have seen too, like for certain conditions like panic disorder and like OCD, there is really good. So these are conditions that really benefit from like what we call exposure. So it's sort of like, you're afraid of contamination, so we're going to make you eat, I don't know, the slice of pizza that's been lying on the ground for 2 hours. And so there's a lot of evidence that doing that in like a masked way, so like in a shorter period of time over and over and over again, can be really beneficial. So I think most of our treatments have been tested in this 50-minute once weekly way. But as we started to interrogate that, we can see, that we could actually speed up treatment if we wanted to.
Yeah, that's kind of what it's getting at. It's like, it definitely works, right? This structure works, but it's like you wonder how much or if anything that you're leaving on the table as far as like potential benefit of different durations, frequency, as you're mentioning. Yeah, because you got to think, the insurance companies are not doing it for, they're doing it for some sort of convenience sake and some sort of billing and risk management perspective.
Yeah. And so one of the cool things about being like an academic treatment developer is that I can provide treatment however I want in my studies. And so because we don't take insurance, we just give treatment away for free. And so we do studies where we'll compare 6 weeks to 12 weeks and then try to figure out who needs 12 weeks and who can be done in 6 weeks. Because if we can move people that can move through the process more quickly, then that will open up spots on a wait list, or, move people off the wait list faster when we think about like, care in a community clinic. To kind of bring it back to personality a little bit, like we've been giving people personality questionnaires and then giving them, so I guess I should back up and say that there's a lot of data that suggests that, really high or low levels of certain personality characteristics are risk factors for different disorders. So like really low disinhibition is a risk factor for substance use disorder. Really high neuroticism is like your emotional disorders, anxiety, depression. So anyway, the idea is that maybe we could make care more efficient by targeting personality instead of targeting symptoms. And so give people personality questionnaire at the start. And then, if they are elevated on just neuroticism, they get the 8-week neuroticism module. But if they're elevated on neuroticism and disinhibition, then they get, those 2 modules. So it's all of what they need, none of what they don't, like personalized and potent.
So this is something that you're testing currently?
Yeah.
Really interesting. So like there's some research around that already?
Mm-hmm. Yeah. So in my like day job, I am a treatment development researcher, and we've tested now our personality-based treatment. We've tested it with 100 people with borderline personality disorder as kind of like the proof of concept. Yeah. We just got like a $5 million grant from NIH to test the personalized version of it.
Yeah, really cool. Congrats.
Thanks. I'm like really excited about it because a lot of times when you apply for money from the government, you have to basically like bastardize your idea so that they'll be like, cool, we'll give you money. But we actually do get to do this like really cool personality personalization project just as we wanted to. So I'm like, very excited.
Yeah, that is really exciting. How many people do you think you're going to be able to enroll in that? Or what's the goal?
Yeah, it's 230.
Wow. Isn't it crazy how expensive things are?
Yeah, it's crazy. So like for therapy studies, we we pay participants to fill out questionnaires, but we don't like pay them for participating in the therapy because the therapy is like a good value.
Right. Yeah.
And we want to
its own benefit.
Treatment seeking people.
Yeah.
So most of the costs for a study like what I do, because I'm not doing like brain scans or taking blood or anything like that, it's all personnel. You need to pay therapists.
Yeah, no, exactly. That's what I was getting at. It's like, you think the treatment for 200 some people, or you think $5 million, like that's a lot of money. And then you're like 200 people. You're like, yeah, it's about what you're going to get.
Yeah, exactly. Right. But then, and this is where I think like prevention, like if you do the math on prevention, which I can't do because I don't know how to do that, but like the cost benefit analysis, right? But like, how much money do we lose in like disability and lost wages and limited like productivity for our gross domestic product, or I don't know, economics things. Right. That like, could that $5 million be like such a drop in the bucket compared to like all of the money that's lost by these 230 people, not being at their sort of like highest potential.
Yep. Yeah. I always think it's weird that this is the justification we have to make in America, where it's like you need to make the financial and capitalistic justification to do something. Right. But yes, I think there is a fair amount of research around that, as far as like lost wages, lost productivity, days time, like time off,
like public health or epi.
Yeah. And I think there's an enormous benefit to prevention, at least on the medical side. You see that very clearly. And also I want to make sure like I'm only making the distinction between medical and mental health because that's how our healthcare system does it.
Oh,
but they're obviously super well intertwined. So we're kind of wrapping things up now, but do you have any closing thoughts that you want to leave the listeners with? This has been a really fun conversation, by the way. So thank you as well.
I'm really excited. This has been great. I mean, from like a personality test kind of perspective, I'd say, don't let a personality test that you took for free on the internet limit who you can become, right? Because personality changes over time and you actually have more control over the direction you can shift it than I think people give you credit for. And then from kind of the therapy side of things, like I said before, change can be really hard, but I've seen people that, were really suffering that were able to kind of stick through that, like it gets worse before it gets better phase and are living, a values driven and very purposeful life.
Great. I really appreciate it. I think it's very easy for people to sort of get locked into, like you were saying, those personality tests, and people can just kind of lament or lay back on I'm this way, I'm that way. And I think it's really refreshing and encouraging to hear, like, you're not relegated to that specific personality type. You can change, evolve through nudging. We're going to link to a lot of your resources. And congratulations on that grant. I think pushing this research forward is really important.
Yeah. Well, thank you so much. Thanks so much for having me.
Yep. Thank you very much. Hey everyone, that's all for today's show. I want to thank you so much for stopping by and watching, especially if you've made it all the way to this point. If you'd like to be notified when new episodes are going to be released, feel free to subscribe and make sure you hit the bell button as well. To learn more about today's guest, feel free to look in the description. You can also visit the podcast website, which is exploringhealthpodcast.com. That website will also be linked in the description. As always, likes, shares, comments are a huge help to me and to this channel and to the show. So any of that you can do, I would really appreciate. And again, thank you so much for watching. I'll see you next time.